If you experience leg pain, tingling, or changes in skin color, know that these signs may be more serious than you think. Blocked arteries don't just affect the heart, they can be sabotaging the health of your legs and feet, putting your life at risk. In today's video, we'll reveal 6 alarming signs of blocked coronary arteries that you need to recognize immediately. Ignoring these signs can lead to serious problems and irreversible complications. Watch now to discover how to identify these critical signs and act quickly to protect your health. Don't wait until it's too late. Your life may depend on recognizing these symptoms in time. Leg pain when walking. One of the first warning signs of blocked arteries is leg pain when walking, a condition known as intermittent claudication. When you feel pain, fatigue, or discomfort in your legs during physical activities, such as walking, it may indicate that blood flow is compromised due to artery blockage. This pain occurs because as you move, your muscles demand more oxygen and nutrients, and if the arteries are blocked, they can't supply enough. The pain usually improves with rest, as blood flow returns to normal temporarily. However, if you notice that the pain is becoming frequent or severe, it is crucial to see a doctor. Ignoring this symptom can lead to serious complications, such as ulcers or gangrene, where inadequate circulation causes permanent tissue damage. Early diagnosis can help prevent the progression of peripheral artery disease and other serious complications. Tingling or numbness in the legs and feet. The sensation of tingling or numbness in the legs and feet can be a sign of serious circulatory problems. When the arteries are blocked, blood flow to the nerves in the legs and feet may be insufficient. This leads to abnormal sensations, such as tingling, numbness, or even weakness in the legs, as the nerves aren't receiving enough oxygen and nutrients. These sensations can be intermittent or constant, and usually worsen with physical activity or prolonged rest. Inadequate circulation can impair normal nerve function, causing discomfort and difficulties in daily activities. If you experience these symptoms frequently, it is essential to seek medical advice. Early diagnosis is key to identifying the underlying cause and implementing strategies to improve circulation. Treatment may include dietary changes, medications, and specific exercises to enhance cardiovascular and neurological health. Another valuable tip is to manage cholesterol control from the most basic actions to the most advanced, which you can access through the exclusive and advanced content available by clicking the link in the first pinned comment of this video. I'm sure it will be the best way to unlock your arteries. Wounds that take a long time to heal. Wounds or ulcers that take a long time to heal on the legs and feet are concerning signs of circulatory problems. Blocked arteries can reduce blood flow to the skin, impairing the body's ability to repair wounds. Slow healing may occur because the blood is not delivering enough nutrients and oxygen to the affected tissues, hindering cellular regeneration. Wounds that don't heal properly are also at higher risk of infection, which can lead to serious complications. If you notice that wounds on your legs or feet are taking a long time to heal, or if ulcers appear that don't improve, it's important to seek medical evaluation. Treatment may include proper wound care, dietary adjustments to improve circulation, and in some cases, medical interventions to address arterial blockage. Early diagnosis and treatment are crucial to prevent further complications and promote proper healing. Change in skin color of the legs and feet. A change in skin color of the legs and feet is a visible sign of circulation problems. When the arteries are blocked, blood flow to the skin may be reduced, causing the skin to have a bluish, pale, or discolored appearance. These color changes may indicate that the tissues are receiving less oxygen and nutrients than necessary. The skin may appear cold and dry, reflecting inadequate circulation. If you notice that the color of your feet or legs is changing, it is essential to see a doctor. An examination may reveal underlying circulatory problems and allow for measures to improve blood flow. Maintaining artery health is crucial to ensure that tissues receive an adequate supply of oxygen and nutrients. Treatment may include lifestyle changes, medications, and medical procedures to relieve arterial blockage and improve circulation. Since you're still here in this video, I'm sure you're finding value in this content. If you want more content like this, just hit the subscribe button and receive the most informative videos to enhance your health. Persistent cold sensation in the legs and feet. A persistent cold sensation in the legs and feet, even in normal room temperatures, may be a sign that blood flow is reduced. When the arteries are blocked, blood does not circulate properly to the lower limbs, resulting in a cold feeling. This sensation occurs because the blood is not providing enough warmth to maintain the temperature of your feet and legs. Additionally, lack of circulation can cause discomfort and make daily activities difficult. If you constantly feel your feet or legs are cold, it is important to seek medical advice. Diagnosis may involve tests to assess circulation and determine the underlying cause. Treatment may include strategies to improve circulation, such as physical exercise and dietary changes. Maintaining proper blood circulation is crucial to avoid complications and improve overall well-being. Increased pain or discomfort in the legs during the night. Pain or discomfort in the legs during the night may be a sign that the arteries are compromised. When you are lying down, blood flow to the legs may be insufficient due to arterial blockage, leading to intense pain and discomfort. This nighttime pain may result from reduced blood supply to the leg tissues while the body is at rest. If you experience intense pain or discomfort in your legs at night, it is a sign that arterial health may be at risk and that the condition is worsening. Ignoring these symptoms can lead to serious problems, such as ulcers and gangrene. Consulting a doctor for a detailed evaluation is essential. Treatment may involve strategies to improve circulation, such as dietary adjustments, specific exercises, and, in some cases, medical interventions to address arterial blockage. Paying attention to these signs and seeking appropriate treatment can help relieve pain and prevent future complications. Being aware of these signs is a good prevention method you can do, and you can also stay ahead of all this by knowing methods that reduce cholesterol naturally. You can access the link in the first pinned comment and get advanced methods, and you can also click on the video on your screen to continue learning here on the channel. Until then, take care of yourself and have epic health.